Hi guys, welcome to my channel. I'm so excited. As you can see, I'm glowing. I'm so happy. Happy holidays. I'm in a holiday mood. You know I love Christmas. I go all out for Christmas. I'm a Christmas baby born on Christmas Day. Yay! So you can see I have my Christmas stuff here. I'm so glad to be here. I've missed you guys. Hope you missed me too. Today's topic, let's see, what do we want to talk about? Okay, let's talk about something concerning my fellow nurses. Bedside nurse looking to get out of bedside nursing, or new grad thinking after nursing school, should I go to bedside as everybody goes, or should I do something different? I have over 30 lists of jobs you can do that are non-traditional bedside nursing jobs. Yes, over 30, you heard me right. There are so many things you can do outside the hospital bedside nursing, and I'm going to mention as many as possible so that you can make your own choice and do your own research and see what goes into it. Some need certifications, some need further schooling, some need bachelors, some need masters. You would have to read more and see which one fits and suits you. So we all know bedside nursing is very burdening, stressful, hectic. You end up getting burnt out. You've done it for 10, 15 years, 5 years, 2 years, 1 month, and you know this is not for you, and you want to do something different, or you want to get out. Don't worry, trust me, I got you. So maybe you've noticed something different on me. I'll leave that to you to guess. I'm all smiles. Have you guessed something is missing? I'll tell you all about that in another video. So let's just focus on today's topic. So first and foremost, you can be a legal nurse consultant. It's very good for somebody who has so many years experience and work in different units and different floors or different wards. You put your experience together and you assist in the legal system by advising when a case comes up. You share your opinion to see what the nurse did right or what the system did right or wrong. Some you have to register with the American Nursing Legal Society to be able to practice as a legal nurse. Read more about that. Number 2, you might like to work as a school nurse. School nursing can be stressful sometimes, dealing with kids, not knowing what is wrong with them. They are not able to communicate well what their problems is. But it's a regular 9 to 5. You have the weekends off, you have holidays off, and school breaks, you have those off. Most of them are monthly paid, you are salaried, and you put in the work. You help students, they come to the clinic with their complaints, but you write a lot of reports. You deal with parents, family members, you call them and tell them about their sick child. You arrange to transport kids to the hospital. Number 3, we have nurse educator. A nurse educator helps new grads or newly hired nurses on the job, teach them the practices, they follow the hospital policies and how to do procedures right. Some of them take nurses to clinicals as well, and some places a bachelor is enough. Others you will require a master's and above to be a nurse educator, depending on where you are working. So you might look into that. That leads me to a nurse researcher as well. Number 4, a nurse researcher you help implement policies, you gather data, analyze them, compare systems, and implement policies in the healthcare system. Yep. So by the time I'm done, I would have lost count. There is Disney nurse. People love that. It's fancy. You work in the Disneyland. You know, there are a lot of tourists that come around with their kids and all. So you help treat little injuries and prevent hazards and all that. There's Nascar Nurse, racing, car racing. Yes, you work as a nurse on a car racing where people get injured, head accidents, collisions and all that. If you have the heart for the racing, if you have that heart, you can do that as a Nascar nurse. A flight nurse. Just like how flight attendants fly all over the world, you're on the plane to assist the doctor on the flight. When there's an emergency or when there's a sick patient on board, you serve as a flight nurse. You travel a lot, you're never home. You're gonna miss family times. You're gonna miss family times and family unions. But if you love to travel, if you love to fly, that is something you like to do. Veterinary nursing. You work in the animal hospital as a vet nurse, assisting the veterinarian doctor and doing simple procedures as well. If you love animals, if you love pets, dog, cats, and all type of animals, that might be a place you like to. It is not as stressful as the hospital, but it is also very stressful in its unique ways. Most of these jobs have their own stresses, but the level is what makes the difference. and the time flexibility for you and your family. Some of them is just 9 to 5, some of them 5 days a week, and you have the holidays and weekends and evenings to yourself. So they all have their pros and cons. But if you're tired of hospital and you want to get out of the hospital, this is something you want to do. We have also urgent care. You work in an urgent care setting where people come with headache, vomiting, diarrhea, nothing serious. If it's beyond you, you refer them to the hospital where they are taken care of. Sometimes it can be work evening shift, morning shift, day shift. It has its flexible hours as well. And you deal with patients who walk in and walk out. You are not doing an inpatient sitting there with the patients all day. Dialysis nurse. If you do not like to interact with patients too much, you have one patient at a time, as always, one patient at a time, your patient and your dialysis machine. You sit by the patient for 3 to 4 hours, you dialyze them, move, get the next patient. If you work in a 12-hour shift, you might work on 3 patients in that 12-hour shift. If one person takes 4 hours, you do your dialysis for them, you monitor them, check their vital signs and all that, get the next patient, sit at one place, focus on your thing on the computer, and you are done. It's something most people like to do. If you like to sit by the patient, sometimes can be very serious. Patients can code during dialysis, so you have to be very attentive. It's risks are involved as well. But if it's something you like to do, it's not bedside, the typical bedside where you are nursing and passing medications and all, even though you can give medications and all during dialysis when the patient is not feeling well at all. Infusion center nurse. So in the infusion center, most patients that come there are cancer patients, terminally ill patients. They all have ports, central line, mid lines, and some you have to throw an IV in and give them the infusions, give them all the medications. They are doing chemotherapy and all that. So they walk in, you assist them, put them in their little cubicle, have your infusion pump, Alaris pump, give them the medication, they go, the next patient comes. In a day, you might see about 5, 6, 7 patients, depending on how long one person's infusion lasts. And it's not bedside. As anything that involves walking is less stressful than a very sick patient that is laying in a bed. So when a person walks in their wheelchair or walks in ambulatory, walks in, you do the infusion for them, you go. That also brings me to aesthetics, aesthetic nursing, where people go to infusion centers just for the fun of it and get some electrolytes and move on. You see a lot of that in Hollywood, and celebrities getting yellow infusion bags, we call them banana bags, just to hydrate and move on because they are always on the go. And also those who have BBL, cosmetic surgeries, after the surgery they need a recovery home, a place to stay briefly before they go home with all their drinks and all that. So you are a nurse in that setting, taking care of a patient who's done their aesthetic surgery, they've done their BBL, breast enlargements or reduction or something, and they have the drains and all. You take care of their wounds, assist them in bed, help them with diets and everything, give them the accurate discharge information, and they move on. And it's fun. You see all sorts of people walking and walk out, basically 24, 48 hours, and they're in and out, and the next patient comes. It's like a home setting, but you're just taking care of a sick friend, family member, or something something like that. Home health nurse, you drive to people's homes. Sometimes you see 4 patients in a day. The downside is you're going to a home where you don't know the patients. You're going to an unknown neighborhood, a stranger's home. That's a risk. Sometimes you can call for an assistant or backup when you don't feel comfortable about the neighborhood you are going to, because we know the neighborhoods and we know the crime and stuff that happens. So when you see the address, it triggers something, and you call for backup. Somebody might assist you, stand at the door whilst you're nursing the patient. So basically you do their vital signs, give them medications, do some wound dressings, monitor their blood glucose, right, input the data, and you are out of there. You drive to the next patient's house. It's flexible. In between, you can make stops to get some lunch to eat. You can make stops to do your personal appointments or get some grocery or something done before you go to the next patient's house. So in a day, you have a regularized number of patients. You see 4, 5, but the reports writing. If you are somebody who doesn't like a lot of typing and paperwork, you might not like it, because you always have to generate a report after you see a patient. So you're always on the go with your computer or your iPad or something in between patients. And if you're not done with your report, that means you have to bring the work home and finish up at home, and that would interact with your family time. So we have outpatient surgical center, whereby a patient walks in for a minor procedure or maybe accompanied by somebody. They come in for the surgery, and They are discharged the same day, or maybe some after 24 hours, they are in and out of there. So it's not like a bedside setting. The patient walks in and gets a fibroid removed, something like that, and they go home right after a couple hours of monitoring. So there's pre-op where you get them ready, get them into their gown, throw an IV in them, and there's intra-op where you are in there assisting the surgeons during the procedure, and there is post-op where the person is done with the surgery and comes back and is all sedated, and you monitor them till they wake up. Their vital signs are stable. They wake up, you get their discharge instruction and post-op care information. You give that to them. You call their family member to come and pick them and send them home. I was in a setting like that as a patient, and it looked pretty cool. So the patients are in and out very quickly. So it's something you can also consider outpatient surgical center. Also, you can work in an endoscopy unit, which is also like an inpatient or outpatient based on where you are. The patients walk in to do an endoscopy for a follow-up for pre-diagnosis. So they walk in, they are hopeful, some of them are anxious to find out what is going on. So yours is just to calm them down, prepare them for the endoscopy, get endoscopy done, and they go home the same day. Then the next patient comes. So it's not inpatient, it's a walk-in and walk-out patient. But we have an endoscopy unit in the hospital where patients are already inpatient, but they wheel them to your unit for them to have the endoscopy done, and they go back to their floor where they are sleeping on admission. So they're not staying with you 24/7. I've had a chance to accompany a patient for an endoscopy procedure, and I had to wait for her because she was nervous and she didn't want me to leave, so I had to stay by her and all that. So the patients are just coming in and going. You are not doing any bedside nursing for them. You're just making sure they are well prepped, making sure their vital signs are stable, do the endoscopy, and get them out, and let the next patients come. So that is something you might consider too if you like looking at the throat and all that. We also have the sales rep or product nurse. It's just like a pharmacy rep. It depends on the products you are selling. You can be selling medication for a company. You can be selling a medical device. I have a friend who sells medical device. So she drives all around selling IV cannulas, the new type called Ethicist. So she goes around and show people how to use them. So the hospital will call and ask them to come and train somebody they newly hired to know how to use it. So hers is to take samples, drive to the hospital, show a group of people. They normally wait till they get enough number of nurses, show them one by one how to use the equipment, and leave samples and leave a contact behind so they can call her when they have any questions or when they have to train other people. So it's a cool stuff you can do. And now with COVID, they're able to do it online, so telemarketing as well. They'll call you online and show you how to do it. I know pharmacy reps working hand in hand with residents and fellows and show them the new drugs and what the drug does and what it doesn't do, its advantage of one that is already existing and why they should start prescribing it. So they have conferences, organize a workshop, and teach doctors, nurses, and the whole medical team about this new product or new drug. So you have to be a people person. You have to be able to talk. You have to have a good vocal ability to be able to talk and convince people to buy your product. You have to be very nice and pleasant, or else they're not going to call you the next day. So that friend is very nice. She teaches them how to use the machine, and that's been good. We have so many. I've even lost count. I don't know whether we are 12 or 30 or whatever, but I can keep going as many as I can. We have cardiac rehab nursing. So cardiac rehab, as the name sounds, the patient has already done some sort of cardiac surgery and they are in rehab, recovering gradually. So yours is to keep an eye on them and monitor their heart rhythm. Most of them have a pacemaker or Holter monitor or something. You have to keep eye on the rhythm. You have to show them the new device, what they can do with it, activity tolerance and intolerance, how they shouldn't push themselves, how they should resume activity gradually, and all about their gadgets and the phone numbers to call when they have any questions and all that. So you help them with their medications, show them how to educate them basically on their new life and how to manage their new hearts or the new gadgets they have and all that. Some are heart transplant patients, some are on pacemakers, all type of pacemakers and all that, and their triggers and what they should know and what they shouldn't know and the conditions they should be in and all that. So you are basically educating a cardiac person who has done surgery and in the recovery phase. We have occupational nurse. I have a colleague who is an occupational nurse. Ideally, they need you to have a master's degree and be able to educate people about the health hazards, the mental stress the nursing job creates on you, how to manage your stresses, and then how to make sure the environment is safe for you to work, to make sure the floor is not slippery, to make sure there are no sharps around to stick you, the right way to do things to prevent hazards. So they are like preventive nurses, and they point out hazards in the occupation. So in this case, we're talking about nursing, so occupational nurse. That is something interesting. So you're always moving around, gathering data, asking questions, taking suggestions, implementing policies, and helping others to be safe nurses and patients to be safe in a very safe environment as well. Public health nurse. So many nurses I know have some form of public health nursing education. You're basically working in the community. You are helping the adolescents, you are helping the kids, you are helping the elderly, making sure they are in a safe environment. You are gathering data, you are doing research, you are generating reports, you are implementing policies, you are making a change in the community. For instance, if there are asbestos in the windows in homes and it's affecting kids, you make sure you give recommendations and how they can fix those problems. If there's a breakout of a disease, you are on top of your game, gathering data and information and contact tracing and all that. So you're always working hand in hand with people in the community. So you should be a people person, because you are going to talk to people in their comfort zones, in their homes, strangers you don't know, and they might not be willing to speak up or open up or let you into their homes. But you should be a people person and be very tactical and know how to handle such situations, because you're working in the community and the community has to love you to give you the information you need to make your work easier. Yes, this one I'll see if I can pronounce it. Nurse ethicist. So you're like an ethical nurse, guiding patients and family members in making decisions concerning their patients, especially life-ending decisions. If they want to be taken off ventilator, who is the power of attorney, who has the right to make this decision for this patient. You are helping them, guide them ethically. It's not too far from what a legal nurse is doing, but your ethics should be working hand in hand with what the laws of the states or the country you find yourself say. So you are like an advocate for them. You are not choosing for them. You are giving them all the options and the pros and cons and consequences, so they can make a good decision. Yes, I don't know if I explained that very well, but you're an ethical nurse and you're telling them in this case. So if the patient states that in this case, when I'm sick and I can't make decisions, call this my sister to make decisions for me, then his daughter comes up and says, I'm the firstborn, I'm his only child, whatever, I have to make a decision. The ethical nurse has to step in and tell her that this is the patient's wish, this is what the patient put down, so we have to go with what the patient wish. But even though you are the only child and all that, the ethical nurse has to guide you and tell you that it is the patient's choice and you cannot be that. Another job is forensic nurse. That is a tough one. I know someone who did it and had a lot of PTSD and anxiety every time, because you are working with rape cases, suicides and homicides. You are running tests, fingerprints and rape kits and all that, and it can be very traumatizing, but you are helping the cop making these investigations to arrest those who are involved, and you have to be very discreet and keep those informations to yourself, and it can mess with your head. But the money is good. Forensic nursing is good and something you want to do, that'll be fine for you. Correctional nurse, you can be working in a correctional home, you can be working with juveniles, so you can be working in a jail as a nurse, helping the inmates or prisoners in there when they are sick or have injured each other or injured themselves. And you need to be tough as well. You need to be very strict, abide by the rules, don't make any bends or flexibility for anybody. You need to be very, very disciplined to work in a correctional home, because they are very manipulative and they will take over and put your head against each other, and you will lose your grounds and they wouldn't trust you anymore. Case manager, a very cool one. You can be a case manager, inpatient or outpatient. A case manager in inpatient, you're making sure the patient is ready to be discharged home fully by setting up their home. If they're on oxygen, you're making sure they are delivering oxygen to the bedside or to their home. If they have a ramp that they have to take a wheelchair on before they enter their house, making sure, coordinating, making the ramp is ready for them to be discharged. If they have any medical devices, commode, wheelchair, walkers, to make sure they are supplied. Also, a case manager at home, I work with a case manager and we're working with the patient at home. We're following up. So she'll have a care plan and give that care plan to me, and I'll have to go by the care plan, make sure I assist the patient to go for games, entertainment, go shopping, do his laundry, keep his house clean, take his medications, write down all his blood glucose monitoring. So she'll always have to be checking and making sure the patient is okay, advocating for the patient because the patient cannot even speak English. She has to make sure the patient gets to all his appointments, medical appointments on time. She has to coordinate transportation, make sure their medications are delivered at home, make sure somebody comes to make his meals, somebody comes to give him his medications and all that. I think these are various options I have given you so far, and you have a vast option to consider if you want to get out of bedside or if you don't want to even start at bedside. Then normally start at bedside. It's very good to start at bedside. You get your skill set, you get experience, you get to know more about nursing, meet people and all. Then you can finally decide what you want to do out of the hospital. So if you've already done that and you think you're done, you are no longer safe, you are burned out, you want to get out, I encourage you to take one of these fields, research about it, see the education required, the certification required, if it's associate, if it's bachelor's, master's, whatever. Look and see what you have to do to get certified to work in some of these fields. My name is Priscilla Kumah, BSN RN, based in New York, and I'll see you in my next video. Take care. Bye bye.